as we know, coronavirus, and specifically COVID-19 or SARS-CoV-2, is a respiratory virus that affects the respiratory system primarily. Patients present with a fever, cough. They can have a productive cough with sputum production, as well as myalgia, body pains, sore throat. So those are the key symptoms that you'd be looking for. Sometimes in about 34% of cases, they present with shortness of breath as well, suggestive of a lower respiratory tract infection, which can be problematic. So when we look at testing, we obviously will not be testing asymptomatic persons. The reason for that is that if you are within the 14-day period of exposure, post-exposure, if you are asymptomatic, you may still develop symptoms at a later point in time. So if we test you when you're asymptomatic, that negative test means very little. The individual still has to continue 14 days of self-quarantine to assure that if they develop symptoms within that time, they're not exposing anyone else to the virus. So we only test people when they're symptomatic and if they fit the case definition. And that is the most important thing to note about testing. We will be using biosafety level 2 PPE, personal protective equipment, and that specifically in this scenario would mean preventing direct contact, droplet transmission, as well as if an aerosolizing procedure is being done, aerosolizing prevention as well. So what that means practically is always don a pair of gloves, making sure that you're not touching any of your mucous membranes, particularly your face, when you've got the gloves on. Having a mask, a surgical mask under normal circumstances when talking to a patient and examining them. And when doing aerosolizing procedures, that needs to be an N95 mask. You also have to have goggles or a visor or a shield on your face to make sure that there's no risk of droplets contaminating mucous membranes.